So next topic we're going to discuss is fractures. What's fracture mean? Have a couple of minutes to think about it. We'll put on the slide a diagram of the skeleton. As you can see, there's loads of bones that you can fracture, everything like that. So have a bit look at the diagram, think of all them bones, dead easy to fracture or break one of them bones. So the next thing that we're going to look at is your type of fractures that you could come across in your workplace. First one, a closed fracture, which means the bone does not come through the skin. Very, very painful. We'll discuss signs and symptoms in a minute. Next type of fracture, an open fracture, where the bone actually penetrates through the skin. Next type of fracture, complicated, which means it could interfere with circulation, causing problems with your circulation. We'll discuss this in more detail later on. Grain stick, this is normally what you find in the elderly or young children. Very, very hard to diagnose grain stick fractures. So, what we're going to discuss now is the different types of fractures. So a closed fracture, what would you say? Basically swelling and everything, but as you can see, the bone has not penetrated through the skin. An open fracture, what would you say with the open fracture? You'd say the bone actually sticking through the skin. So various types of open fractures. Again, open fracture, what is the problem with an open fracture? Have a couple of seconds to think about it. Infection. So if you look at the slide, note the poor aseptic technique. It's just been left open like that, nothing to stop infection, and that is one of the big problems with open fractures, infection. Again, treat for what you see. You cannot leave it uncovered when it's an open fracture. You must cover it. So with your bleeding, you discussed about using packing. Don't be frightened to pack round it, but please do not leave fractures that are open uncovered. They must have a sterile dressing on them or a bandage. Dislocation. Again, you can see where the knee is not in the place it should be. That's dislocated and that's normal. So there's nothing you can do for that apart from keeping the person still till the ambulance comes. Do not try to move somebody that's got a dislocated leg. So keep them as still as possible, keep them warm, reassure them. You don't give pain relief, it's not your job to give pain relief. So remember, just keep reassuring them and phone 999. Signs and symptoms of a fracture. We do have mnemonics throughout the first aid course. We'll start off with P for pain. You will have a lot of pain. Loss of power, you won't be able to move. Unnatural movement, it could be bent round the opposite way. And when he tries to move, which would be very painful, it doesn't move the way it should. Swelling or bruising and deformity. Irregularity, you look at the right one, compare it to the left, it won't be the same shape or size. Crepitus. All crepitus is when the bone rubs against the bone. So it's not a very nice sound. And the last one, tenderness. So them's your signs and symptoms of a fracture.